What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doctor, but I am a doctor of physical therapy. And this is the first time check for you to check out my channel, which, judging by my views, it probably is. I just want to say welcome. Thank you for stopping by and giving us a look here. Well, today's video is going to be kind of a wake up call for patients, for family members who have patients who are in physical therapy, patients that are specifically not wanting to do their home exercises, patients that are only um, wanting to do work with the therapist when they attend physical therapy or when the therapist comes to their home or comes into their room, when they are just the types of patients who are very resistant to doing anything to better their circumstances. That is really who I am targeting, because something that is very important for you as a patient to understand and for family members of patients to understand, it's really critical that you get this. Your situation can always get worse. Things are not necessarily just going to improve if you don't try to do something to make them improve. So it can be really, really frustrating when you see this as a physical therapist, especially when you're the one that's trying to help motivate that person or trying to instruct that person on um, doing the things that they need to do to improve where they are. And just if you go and talk to someone that is a therapist or the physical therapist, go talk to them, and I guarantee you they can tell you stories of those patients who they were not able to reach and their situations significantly improved. I'll tell you one patient that comes to mind right off the top of even thinking about this was a lady that, well, I don't even want to identify any, but this particular patient, let's say, uh, was having knee pain and was not wanting to do exercises to strengthen uh, the that patient's hips, not wanting to do the things to continue to walk around, continue to push into pain. The This particular patient, we told multiple times, like, look, you've got to get up. You can't just sit in the chair all day. You can't just avoid movement because it hurts a little bit. Um, there are things that we can do to help and that we can teach you to help. And to some extent, or a lot of times that will, go a long way. But yeah, there might be times that you're having to push into that pain so that you can continue to function. So we worked with this patient as much as we could, did it a couple of times in and out with this particular patient, and then got an order for to go and see this particular patient in their home. And this was a couple of years down the road now. And turns out that patient could not walk. Couldn't walk because they couldn't stand because they could not straighten their knees. Exactly what we had been warning about, exactly what we've been trying to explain to the patient that could happen, did happen. Their situation did not improve just over time and did not just get better on its own. Their situation got worse, got much worse. So I had another patient that comes to mind who was over 500 pounds, which as a little aside, if you are um, trying to battle weight, don't let yourself get over 500 pounds because once you do that, everything changes. It's very hard for anyone to help you after that, just from my experience working with this particular patient. But anyway, that's an aside. So, with this patient, we were able to get this particular patient up. We were able to get this particular patient to walk, could actually get them to participate with some movement activities. Then they had a health issue that then had them go on the decline. And we kept fighting through that. It's hard in physical therapy to make significant progress if your medical is all over the place. If your medical is unstable, then PT it's just hard to progress. If your medical is stable, we can do great things with you, but when it's unstable, it can be more of a challenge. So this particular patient's medical care went into an unstable point, and we continued working, got to a more stable position again, and as this particular patient, because of the medical condition that had like worsening, this person, this particular patient wound up being bedbound, and as we were progressing along, trying to improve that status, and then trying to improve, going from not being able to move to then being able, trying to be able to sit at the side of the bed, etc., etc. Then, as because of the weight of this person, they could not actually be transported in or go in a normal car to an appointment or go to doctor's appointments and things. So they had to have EMS do it. Well, as this particular patient has gone through, was already in a difficult situation because of their weight, and was already having difficulty with mobility and all this, and then wound up having all these different medical condition issues, and we're trying to fight through all of that. Then as things were looking to stabilize off a little bit more, this particular patient was picked up by EMS to be transported to go to a physician's appointment, and their foot happened to fall off of the gurney as they were going into a doorway and snapped their toe. And so then it all but wound up ruling physical therapy completely out. This patient was completely not weight bearing on that particular leg because of that. And then, so the physician actually required us to hold all physical therapy and to stop with everything. And this particular patient's health then just took a significant decline after that. And they eventually wound up passing away. Um, so it's not appreciated a lot of times by patients that your situation doesn't have to improve. If you are not going to fight, claw, scratch, work hard, do everything you can to improve yourself, your situation can get worse. Make no mistake about it. I've seen it. Your PTs that live around you and work around you, talk to them. They've seen it too. We're trying to help you prevent that. Okay, so this video is really more kind of a little bit of a wake up call, hopefully, for some of those patients that just don't want to work for whatever reason. Understand, your situation could get worse, and we don't want it to do that. So please do your exercises. Do what you know that you need to do. You've got to move. You've got to get stronger, and you can do great things when you start pushing in that direction a lot of times. But to not try, to not give effort, and not work in that direction does not necessarily lead to any good things for you. So my prayers are that you will listen to this video, and that something will click and will register with you, and that you will start or decide that you're going to move forward, you're going to progress, you're going to do the exercises, you're going to do all the physical therapy visits, you're not going to cancel their visits when they're coming to your home. You are going to make it into that outpatient facility to go and do the therapy that you need to do, and that you will move forward and accomplish all of your goals. All right. Y'all have a good one. Bye.